The most characteristic signs that might make someone suspect tuberculosis, or at least think about it, are a persistent cough lasting more than 3 weeks, a prolonged low-grade fever, around 37.2 to 37.6 degrees Celsius, unexplained weight loss over a short period of time, persistent shortness of breath that doesn't go away with medication, and night sweats. This is a very characteristic symptom of tuberculosis, profuse sweating at night, which our patient specifically points out. If we take a closer look at each symptom, a cough that lasts longer than 3 weeks usually becomes quite distressing for the patient. That is, the patient had some kind of viral infection, seems to have recovered, feels fine now, but the cough persists. It's stubborn, it doesn't go away even with medication, and this sometimes makes the patient see their family doctor to find out the cause of such a persistent, troublesome cough. The temperature is low grade, and sometimes our patients don't even notice it, but if they measure it and find that it stays elevated for a month or more, that's also a reason to see a family doctor with a suspicion of tuberculosis. Unexplained weight loss usually happens suddenly. Over the course of a few months, a person can lose up to 10 kilograms while maintaining their usual eating habits and diet. This is also a concerning sign. If we manage to detect tuberculosis at an early stage, it responds very well to treatment, and after some time, the person becomes healthy again. But if someone seeks help too late, we can end up dealing with complications from tuberculosis. These are the two most serious and most common complications: pulmonary hemorrhage and spontaneous pneumothorax. Hemorrhage most often occurs because a fairly large blood vessel is located inside a cavity of tissue breakdown. Its wall becomes deformed and damaged, and when a person coughs, it can tear, leading to heavy pulmonary bleeding. Spontaneous pneumothorax develops with massive destructive changes in lung tissue, that is, when there are large cavities of tissue breakdown. If these cavities are located close to the surface of the lung, then during physical exertion or a severe cough, the wall of such a cavity can rupture, and air escapes into the pleural cavity, meaning outside the lung. Thus, this is a complication that requires surgical intervention and further treatment in a surgical hospital.